My blood pressure was very high. I would go to the community health facility, and it would be 26, 25. It has gone as high as 27. The physician would tell me to go to the emergency care unit, and I would have to go. I've already had 2 strokes. It left me with difficulties to move my left leg. I stopped doing many things. I stopped going out. I would go out a lot, and now I don't do that anymore. My finger was hurt, and I didn't know what it was, and it started to get worse. When I got to the physician, she told me that I had to go to the ER to amputate my finger.
I've worked for a long time in Aracaju digging pipes underwater, until I couldn't work anymore. Then it got to the point where they had to retire me. I felt many problems due to my high blood pressure. I was always dizzy, I was always hospitalized, and I would go to the ER very often. I was there almost every week.
Chronic patients walk constantly through the healthcare system without a professional to accompany them and without any priority. Each chronic patient costs the public health system, on average, $5,400 a year, while the rest of the population consumes $215 for each person. The company PGS Medical has the technology that solves this problem. We propose to cities the creation of HRCs, highly resolutive centers.
PGS Medical has come to aid the cause of bettering the population's quality of life. It is very rewarding to implement a project like this in the city. More than the savings for the government, it also gives quality of life to patients and their families, since sometimes family members stop working to take care of the patient at home. What we understand is that the greatest gain of any public administration is to see the happiness on the face of our people. Here in Penedo, it's no different. We believe that when we want to do the best, we can.
The HRCs use PGS medical software and remote monitoring technology to aid basic attention teams to perform special medical care to patients carrying chronic diseases. With the utilization of HRCs and PGS medical software, the administration can track the results obtained by the city with health management. These technologies together provide life quality to the population and saving for the public coffers.
We reduced 56% of our hospitalizations with chronic patients and also lessened the number of resources that the public system needs to spend on these patients, making them feel less pain and bettering their lives. So now I am certain that the PGS Medical Project is fundamental to the well-being of our chronic patient population. My team is small for that, and PGS Medical has come to fulfill our needs with amazing quality. So we are very happy with PGS Medical in Penedo.
In the highly resolutive centers, healthcare professionals are trained to use the artificial intelligence software PGS Medical. The software orients the best healthcare attention practices. The software also organizes the schedule of the professionals based on the complexity of the patients being taken care of, measures the bettering of life quality, and the savings obtained with the care offered.
You receive the patient data and insert it in the system, and it generates a care plan tailored to that patient. The constant of appointments, consultations, and household visits is all given by this software. So for me as a nurse, there really aren't words to explain it. Every patient that we see get better thrills us. So for us, it is very gratifying.
The HRCs have equipment that remotely monitors the state of the health of ill patients. These technologies are saving lives.
This project has been wonderful to me. I feel much better. My diabetes has lowered, my blood pressure has never been 13, and now it is. They got me a rheumatologist for my lupus, and they are also getting me an appointment so that I can have my eyesight surgery done. All of that. This project is being amazing for me. Not only it was, it still is. I don't go to the ER anymore.
Thank God I got better. My medication is better now, and it is thanks to them that I feel this great. I haven't gone to the ER in the last 3 to 4 months. I never went again.
We were recognized by the IFC, a branch of the World Bank, as one of the 50 most innovative health companies in the technology sector in the world. PGS Medical develops technologies for remote monitoring, artificial intelligence, and protocols that bring results that are impressive.
PGS Medical has surpassed all expectations in reaching its goals. In 2020, we hope to treat at least 2,600 patients in the city of Penedo. That will create a savings of at least 1.8 million to the public coffers this coming year, and we will apply these resources in basic care attention to better take care of the population.
PGS Medical, a public-private partnership in service of health innovation.